Hi all, welcome again to my channel. I am Dr. Zina, a full-time dentist. Today we'll be talking about the difference between pulpotomy and pulpectomy. But before we continue, make sure to hit the subscribe button down below because it will really help me to do more and more videos. Now for pulpotomy, as the name suggests, it is a removal of the coronal portion of the pulp. So the radicular portion or the radicular pulp is healthy. Okay, the coronal portion is infected, so we remove only the coronal portion of the pulp and leave the radicular pulp because it is still healthy. Now you might ask me, what are the contraindications for pulpotomy? If the tooth is necrotic, okay, or if there is a fistula or pus or mobility, swelling, the tooth is tender to percussion. For the radiographical signs, if you see internal resorption or external resorption, or there is a periapical radiolucency, it is contraindicated for pulpotomy. So the main indication for pulpotomy is when the patient comes to you showing symptoms of reversible pulpitis. Reversible pulpitis, then the treatment will be pulpotomy. But if irreversible pulpitis or necrotic pulp, then the treatment will be pulpectomy, not pulpotomy. So pulpectomy is the excision of the pulp, as the name suggests. So removal of the pulp, both the coronal and the radicular portion of the pulp. So here the patient will come to you representing signs of irreversible pulpitis or necrotic pulp. Now for the pulpotomy steps, number one is to give anesthesia, whether it is infiltration for upper or block for the lower. Second, apply rubber dam. Third, you need to remove the caries fully. Fourth, remove the coronal portion of the pulp. All should be removed. Okay? Then, lastly, the pulp chamber will be sealed and tooth will be restored with a stainless steel crown. Now for the pulpectomy procedure, the patient will come to you representing signs of irreversible pulpitis. Here the RCT will be simplified in comparison with the adult RCT. In here you need to remove the caries and then make a drop. Okay, then remove the pulp, and once you remove the pulp, apply zinc oxide eugenol as a filling material. Here we do not apply gutta-percha for the primary teeth because it is a non-resorbable material. And as you know that the milk teeth, they will be replaced with a permanent teeth. So we don't want a non-resorbable material. We need a resorbable material. So the material of choice to be used is the zinc oxide eugenol applied via a file into the root canals. So as you can see, for the pulpotomy procedure, make sure that the roof of the pulp chamber is all removed, meaning that the coronal portion of the pulp is removed, and you need to have a smooth wall to your access cavity is very important. So you need to do a good de-roofing, but of course not with the safe-ended burr. You can use the high-speed round burr, and in order to do de-roofing of the pulp chamber, in order to have a smooth walls to your access cavity, use a low-speed round burr to remove the caries and do a drop, but the rest is for the high speed in order to extend your outline to see the pulp chamber, in order to see the pulp canals or the radicular pulp, as you can say. So let's start once again repeating the full steps of the pulpotomy procedure. Now, step number one, after you give anesthesia and place rubber dam, you need to remove the caries fully with a low-speed round burr. Step number two, to remove the coronal portion of the pulp. Okay, so all the pulp in the coronal, which is the coronal portion of the pulp in the pulp chamber, is removed fully. Now, in order to stop the bleeding, once you remove the coronal portion, you need to apply a cotton pellet immersed with a saline solution. Step number four, apply ferric sulfate with a microbrush for 15 seconds. Then wash and dry and judge the condition of the pulp, whether it is indicated for pulpectomy or no. If the color of the blood is pink color, then you proceed with pulpectomy. It's okay. If the color of the blood is dark pink or dark color, or no bleeding, or profuse bleeding, or bleeding does not stop at all, then it is indicated for pulpectomy and it is contraindicated for pulpectomy. Very important, we should not have any bleeding coming from the radicular pulp, only the coronal portion. Since we remove the coronal pulp, so we need to have bleeding only from the coronal pulp. We should not have bleeding from the radicular pulp. There will be bleeding in the radicular pulp only if the radicular pulp is inflamed, therefore it is indicated for pulpectomy. Note, why we need to apply ferric sulfate? Because it is a homeostatic agent that will arrest the bleeding in order to check if the case is indicated for pulpectomy or pulpectomy by applying ferric sulfate. Once you are done and the case is indicated for pulpectomy, you need to apply a thick layer of zinc oxide eugenol in the base. A thick layer, not a thin layer. The zinc oxide eugenol has an antimicrobial properties, which means that it will prevent the bacteria traveling down into the radicular pulp so that no bacteria will reach to the radicular pulp and it will stay healthy as it should be. Step number 6, you need to apply a GIC filling material. Now, if the tooth is near to the exfoliation period, no need to restore the tooth with stainless steel crown because it will already fall out. But if it is not close to the exfoliation period, then you need to restore the tooth with a stainless steel crown. And I will make a separate video about the steps of stainless steel crown. And now you are done with the pulpectomy procedure. Thank you all for watching my video. If you enjoyed, don't forget to hit the like button, comment down below if you have any questions, and don't forget to press the subscribe button for more and more videos.